The statistics say that even if you operate in a completely sterile environment, there is still a risk of infection. The problem with infection is that it has devastating consequences. And if you get that infection and you end up in ICU, you have up to a 40% chance of not coming out of ICU. And penicillin is not that effective anymore. Bacteria have become so clever that they overcome the onslaught of antibiotics. And this bacterial resistance is a huge problem in medicine. In your body, you have white blood cells, red blood cells. Red blood cells transport oxygen, but white blood cells, they make hypochlorous acid. This is our first line of defense against infection. It is completely non-toxic because it comes from the body, it comes from inside your white blood cells. It takes care of the infection within hours, kills the biofilm, stops the inflammation, and the wound heals in a fraction of the time. So, morning, Elmarie.
Morning, Harry.
Nice to have you here at my podcast.
Yeah, it's exciting. Thanks for inviting me.
Yeah, today we'll talk about infection. We both come from the medical background. If you can introduce yourself.
Yes, I'm Elmarie, and I am from the Centurion Day Hospital. I'm the owner and the general manager. It's a facility that does same-day surgery procedures in all the different modalities. A lot of cosmetic surgery, maxillofacial, ENT, gynae,
so typical
dental.
Elective surgery, short cases.
Yes.
You can be in the morning, out at night.
That's right.
Back at home. Saves a lot of money that way.
Absolutely. Safe, reliable, patient-orientated. It's really a very friendly environment and people love it, and the whole industry is moving towards appropriate procedure and appropriate facility.
Yeah, that's also where the idea of conscious sedation comes from. Mm-hmm. You're not fully anesthetized, but just feeling a bit woozy during the procedure, and your recovery is much quicker. It can also lead to some funny moments waking up. Anyways, we're here to talk about infection. I'm from a medical background, and I want to talk about infection, not specifically to your hospital or any day hospital, but in general, because infection is the first thing that people think about when we talk about operations. And the issue of infection is particularly pertinent now due to things that have changed amongst the germs, what we call pathogens that cause infection.
Yes.
So you would be aware of infection, and I'm sure that when people hear operation, that's the first thing that comes in their mind, and they're worried about it.
Yes, that is one of the reasons people prefer day surgery facilities, as it is a safer environment. The possibility of acquiring an infection is much lower.
That's, of course, one type of infection. The other type is that you already are septic, so you don't deal with septic wounds, open sores, and things like that, which, of course, exponentially contribute to bacteria in a hospital. But we're talking about a clean environment. Yet, the statistics say that even if you operate in a completely sterile environment on a non-septic case, there is still a risk of infection, and that's called surgical site infection. And that can be really annoying when it happens. And have you ever come across cases of infection, even if it happens for a long time after the operation? I think the statistics say there's a time for about 30 days after an operation that you can still get an infection from that operation.
Oh, you have to tell me more about that. Yes, we had some cases, but usually people that will be readmitted to other hospitals a week after they had surgery there. So not that many, because it is rare, but it can happen, like you just explained.
Yeah, that's the point I want to make, is that it's not the fault of the hospital or the doctor necessarily if infection happens, because bacteria are everywhere. They are in our water pipes, in our air conditioning systems. I think there was an interesting statistic that I read about a type of operation room. It's called the Charnley Theatre. It's a highly sterile environment, usually for joint replacements. And they did a check, and then within half an hour, there were already bacteria in that theatre. And not because somebody carried it in, but it comes through the aircon or through water. Surgeons wash their hands.
Even with all those filters.
With all those filters, they get in. The problem with infection is that it has devastating consequences. So if you go for an operation and you get an infection, the results of that infection far outweighs the results of the operation, and the cost implications are there, and it can be very high. I think if you have a hip replacement and it becomes septic, it'll cost up to R1 million just to get back to the point where you had the operation the first time. So it's important that people understand about infections. So what causes infections? First of all, they're caused by bacteria and fungi and viruses.
Combination.
Or single or in combination. Most people will know about penicillin.
Yes.
Use it against infection. And when penicillin was discovered by Alexander Fleming in the early 20s, it had a major influence on infection. So for the first time, wounds were treated with antibiotics, and that had a huge implication for the survivability of soldiers during the Second World War, for example. So from the 1920s, when he discovered bread mold had the ability to kill bacteria, till developing full-blown, pure, crystalline penicillin, took about 20 years. And then it had this magic effect. But something changed in the last last 100 years, and penicillin is not that effective anymore. In fact, bacteria have become so clever that they overcome the onslaught of antibiotics. And they're called antibiotic-resistant bacteria.
That is the biggest.
That's the biggest
scary
fear.
It's a big fear.
Because you get infection, and they give you antibiotics, but the antibiotics have no effect.
That's right.
So there's massive research going on all over the world, and we developed something that does have an answer to this problem of bacterial resistance. And I want to talk about that today. So
yes, please.
It really is a message of hope and a message of the relief of suffering. How is it possible that we can overcome this bacterial resistance? And quite surprisingly so, the answer lies in the body. There is something in your body that your body uses as a natural defense, which we isolate and we manufacture now in large concentrations, and we can put it in a bottle like this. And then it can be used as prophylaxis or as treatment.
Do you know more about the statistics of how many people are dying of sepsis, post-surgical sepsis in the hospitals?
In a country like the United States, it's hundreds of thousands of people a year die of sepsis, specifically hospital-acquired infections.
Yes.
And it happens in every country. If you go to a hospital for an elective procedure, so in other words, you have an operation where there's not necessarily an open wound, but you create a wound to do the operation, so there's no contamination as such, and you end up in ICU, you have up to a 40% chance of not coming out of ICU. So the potential results of infection being there is devastating. But I want to talk about prophylaxis.
Yes.
What is prophylaxis? Prophylaxis is prevention. So this new technology that I will explain in a little bit more detail now is not only the treatment of infection, but to prevent it. Because really a stitch in time saves 9, even though it's more appropriate for surgery to say that. The ability of new technology that has been developed to stop infection from happening or to treat it after it's happened gives a huge sense of comfort, or should give a huge sense of comfort to
Yes.
people like you in the hospital industry.
It certainly does.
So I want to talk about this product called hypochlorous acid, and it's called Trifectiv because it does 3 things. But first, a little bit about history. In the late 1800s, there was an English chemist that discovered that if you take bleach, normal bleach that we know, household bleach, and you add an acid to it, and in his case it was called boric acid, then that bleach, which had some antiseptic effect, suddenly became much more effective as an antiseptic. Mm-hmm. Antiseptic, of course, means a liquid that fights infection. So the development of this modified form of bleach sort of introduced the chemistry world into hypochlorous acid. Sodium hypochlorite is bleach. So hypochlorite is an oxygen and a chlorine atom together. And our body uses that oxygen, chlorine, hydrogen molecules to fight infections and to heal wounds. But this molecule is the secret. It's the prince of the molecules in your body because it keeps us alive.
Okay, that's interesting.
So this molecule is released from bleach if you add some acid. And that's what happened in the case of Dakin. He released hypochlorous acid from bleach. We do it every day. If you have a swimming pool, you release hypochlorous acid also from bleach, but your bleach is a powder that you put into the water called calcium hypochlorite, not sodium. And when you chlorinate your pool, you have to adjust the pH, the acidity of the pool. So there's pool acid and there's, you have to get the balance right of the chemistry of the pool. And that's because the right pH releases the right amount of this hypochlorous acid that I'm talking about.
Yes.
This prince of molecules, which happens to be the same molecule that's made in your white blood cells. In your body, you have white blood cells, red blood cells. Red blood cells transport oxygen, but white blood cells, they make hypochlorous acid. And this is
amazing.
This is our first line of defense against infection. When you are exposed, like for example the COVID time, when people are exposed to COVID viruses, not all of them got sick, but you could get sick and it could be very serious consequences. Some people do not get sick. Some people do not get flu. Some people do not get certain diseases because their immunity, that first line of defense, hypochlorous acid immunity, is responsible for stopping the trouble.
That's right, and that's why also when your white blood cell count is low, your resistance is much lower and you're more prone to infections.
Exactly.
Mm-hmm.
So this white blood cell and what it makes, what is kept inside the white blood cell is of utmost importance in infection. And that's where we go and fetch the story of what Trifectiv is. Because we make this molecule in the same way as the white blood cell makes it, and we overcame very big difficulties in making it because it's a very intricate process to make it, and it's kept inside the white blood cell. So you can't let it drift freely in the blood. It doesn't last. White blood cells take this molecule to the site of infection or injury, and they release it, and then they do the job. And then they destroy it in the process. They sacrifice themselves, these molecules. Yes. All we managed to do was to make a pharmaceutical hypochlorous acid in large concentrations that has the ability to completely wipe out any risk of infection. And if there is infection, to treat it within seconds, literally. So it's a very, very powerful way of controlling infection.
Yes, we used once the doctor, orthopedic surgeon, there was a knee did a knee replacement, but the wound got septic, and it was the first time we used Trifectiv wound irrigation in the hospital. And I can still remember the reaction of the personnel, the sisters and everybody, the scrub sisters coming out. And it was when they irrigated, that when they opened up and they irrigated, they could actually see the reaction of how Trifectiv
attacks the bone.
Just destroyed it. It's like
it's a visual thing.
It's a visual thing, and they all been. It was they'll never forget it.
Yes,
it's interesting.
It is very dramatic. First of all, bacteria became problematic because they recognized antibiotics, and this bacterial resistance is a huge problem in medicine because we can't give the standard of care antibiotics like we used to.
It doesn't work.
We need constant development of new antibiotics, and it's surprisingly difficult to make an antibiotic that is not recognized by bacteria. But there is another problem with bacteria, which I regard to be even a bigger problem than resistance. And that is that bacteria have developed an security blanket, literally, that they put over themselves in the form of a slime. We call it biofilm.
Yes.
Biofilm is very, very dangerous because it hides the bacteria from whatever we do in the use of normal antiseptics like betadine and chlorhexidine or antibiotics that are used. They say that bacteria that have covered themselves in biofilm are up to 1,000 times more resistant to antibiotics than ordinary bacteria. And it is such a scary thing, this bacterial village, we can call it, because it contains different types of bacteria and they communicate with each other and they anchor themselves to the surface underneath them, like on bone or on skin or on a wound. And then they decide amongst themselves that they're going to secrete this slime layer because they sense there's a risk to their existence. So it's an added danger with bacteria these days. Not only do they become resistant to antibiotics, but they've developed this physical protection, this barrier.
Yes.
How often? 95% of infections now are recognized as becoming biofilm infections. And the thing that they do, biofilm, is it irritates the tissues where it is and it forms inflammation.
Yes.
And we know that once you get inflammation, wounds don't heal.
That's a problem.
So they not only protect themselves, but they manipulate their environment to suit them.
Do they actually change? Do they get clever? You said they've got intercell intelligence.
And they communicate, yes. So they would, for example, they would sit on the surface. And if you put your hand there and you scrape them off, the other half that stays behind immediately adheres more secure to the surface. Everybody knows biofilm by another name, dental plaque. That's the most common biofilm that exists, and we know how much trouble that biofilm causes. But we can brush it off. We can physically remove it. When it's in a wound, you can't brush it off with a toothbrush.
So, looking at it practically, the biofilm is like if you open a wound and the wound is not good. So that is the crust that forms there. And underneath.
Now we're talking about infection. What does infection look like? Yeah, a very good question.
Okay.
So the classic infections that we know about is where a wound becomes red and very painful, and it can form pus and it can become an abscess. That's the type of infection from the past. Now, infections that form biofilm, they look different. It's a low-grade infection, not a high-grade infection. So there's low-grade, you don't know, something's wrong. The wound is not what it should be. It's not healing. And if they operate it inside the body and they open up, the slime just comes out. And that's where this reaction happens that you talk about. If you put Trifectiv in the wound, it immediately attacks and destroys the biofilm in a very visual way. And the most amazing thing about this molecule, hypochlorous acid, this pharmaceutical molecule that is in this product is that it is so reactive that it is on the lookout all the time for things to fix that are not right. And of course, biofilm is just a field day. So it attacks it, and within seconds, it destroys the biofilm, and it destroys the bacteria sitting underneath the biofilm trying to protect themselves. And that is a huge positive for a surgical intervention situation where there's risk, and there's always risk.
I'm still stunned. I'm just going back to it's reproducing the white blood cells. The function of your white blood cells, isn't that? Well, that's just.
It is a natural way of dealing with infection. So the new infection treatment methods. And Trifectiv last year was chosen as one of the top 10 infection control products in the world. The benefit of it is completely non-toxic because it comes from the body, it comes from inside your white blood cells. It's completely safe for children, pregnant women. The application is wide, but in order for it to work, it needs to be where the problem is. So there it has a shortcoming to bacterial, to the treatment of bacteria with antibiotics. And I want to make it clear, antibiotics are still necessary.
Absolutely.
This is just a help for antibiotics. Yes. The way it deals with bacteria is different from antibiotics. Antibiotics make bacteria sick and they die. Takes a day or 2 or 3, but they're life-saving still in most cases. So the resistance and the development of biofilm is an added problem that can now be addressed. I just want to make sure that you understand that. So the way that we deal with infections or prophylaxis is to use the Trifectiv where you are going to operate. So if you operate and there's a large open area, you can spray it into the wound or you can pour it into the wound. If there's any biofilm busy forming, it'll immediately destroy it in very, very high log counts, up to 7 log counts. And then the destruction is also on the slime, and that's the reaction that you're talking about. It turns the slime black when it reacts inside the wound.
That was what was reported, yes.
Yeah. So the effect is visual. It gives the surgeon comfort because he can see that it works. And once it's done its work, it disappears. It only becomes water again. I'm sure you wonder what log means.
Yes,
log reduction.
that I want to ask you that now. I mean, explain this log.
So if you, for example, have 10 bacteria and you've killed them, you've reduced them by 1 log. If you have 100 and you kill them, you've killed them by 2 logs. So a log is to the power of 1 times the power of 10. So log 5 means 100,000, and log 6 a million, and log 7 means 10 million. So if you have so many bacteria, say you have 10 million bacteria, and you've put Trifectiv in the wound, within a minute there will be 0 bacteria, and then 10 million is a 7 log reduction. So there's 7 zeros. The necessary log reduction that you need on a regulatory aspect is 3. So 99.9% reduction in bacteria is usually enough to be able to call your product an antiseptic. And you will see it in antiseptics sold in the shops.
Yes.
On the label it usually says kills 99.9%. Or if it says kill, that's log 3. If it says kill 99.99, then that's 4. So if you talk about percentage, 99, every 9 is a log, and every to the power of 10 that you reduce it with is a log. So the 10 to the power of 7, 10 million becomes 0, that's log 7. So Trifectiv kills all disease-forming germs by log 7.
Yeah.
It's a total Trifectiv.
Not other products.
Not all hypochlorous acid product. Yeah, we have got to talk about that for a moment. Thank you for reminding me.
That's important, yes, because I got rid of the other products in my hospital when I discovered this medical grade hypochlorous acid product.
So hypochlorous acid is difficult to make. The most common way of making it is by putting an electrical current through salt mixture, table salt and water. And then on the positive wire, there will be some hypochlorous acid forming, and on the negative wire, there will be some baking soda forming. That's a chemical reaction that happens. But sodium, being the main component of normal, ordinary household bleach, has a way of winning the competitive fight against the hydrogen in hypochlorous acid. In the good molecule is very reactive and completely tuned into saving the person, where bleach, the sodium molecule, is more intent on going and leaking out of plastic and reacting with plastic and doing things that are toxic, like forming specific chemical bonds that are not healthy for the human body. So everybody knows bleach is dangerous. I mean, people drink it and bad things happen. So in order to keep bleach out, we developed a way of making the product very similar to in the body, that is sodium-free or bleach-free. And that is the reason why it is so effective, because it mimics the body's molecule precisely.
I'm sure you did a lot of research and a lot of work
it took years, more than 15 years to develop it.
And to get that log.
That log, yes. That is true. So what does it mean for day hospitals? Nobody wants anything to go wrong in surgery, or for acute hospitals for that fact.
Oh, mostly acute.
The technology is there to prevent infection from happening. So if you wash a wound out, whether it's a root canal or a breast implant or a tummy tuck, or you wash the area out, you will not get infection. And it's a small price to pay for a big benefit. If you do have a case of infection, whether it originated from surgery, as we used to say, St. Elsewhere.
Yes.
Or
I've got a case like that. Yes.
Or it is a contaminated wound, like a dog bite or a car accident or so. Then doing simple, ordinary dressings with this product takes care of the infection within hours, kills the biofilm, stops the inflammation, and the wound heals in a fraction of the time. So the technology is not only for the prevention and treatment of surgical infections, but also for the prevention and treatment of wounds that are already infected.
And post-surgery.
Yes, so any wound that is the result of either an operation or an injury or cancer treatment or whatever can benefit from this. And it is so simple to use that people can be taught within 5 minutes how to do a dressing. It's simply using gauze, wetting it with the product, putting the wet gauze on the wound, keeping it there with something that can breathe, like a crepe bandage.
Yes.
And every day when you take that bandage off, it takes off all the dead biofilm and all the stuff that's not supposed to be on the wound. And you replace it with a new dressing, and before you know, the wound is healed.
Absolutely. I see that. We've got at the hospital, there is quite a large cosmetic surgery practice with 3 plastic surgeons working there. And they perform many operations. And we introduced this to them. And in the practice now, standard wound care, post-surgery, they've been doing it for more than a month now. Post-surgery, they use Trifectiv wound care. And they also dress the wounds for that. And they report to me, the wound care sisters, they say that the healing is just much quicker, and they can see, because reduced inflammation, less scarring.
That's the other benefit that I mean. Yes, thank you for mentioning that. Inflammation causes scarring, or scarring is the result of inflammation. And because biofilm leads to such a long, low-grade inflammation, scarring is excessive.
Yes.
And scarring is not always what we see on the skin. For example, you have a cut and there's a scar. Scarring could be in your lungs, for example. If you've had an infection in your lungs and you've healed from it, you have restricted ability to breathe. It's called pulmonary fibrosis. In other words, there's scarring inside the lungs that limit your lung function.
Yes.
And that is much less likely to happen if you, for example, have a lung infection and you nebulize, because this product can also be nebulized. Yeah, you can see what a nebulizer looks like. And and if you press it, that's the sort of fine mist that you can breathe in.
Yes.
And it kills the bacteria, it kills the biofilm, which comes out as a huge amount of phlegm. It stops the inflammation, and there's much less risk of scarring.
Yeah, I've got another story there. One of my older employees, when I became aware of Trifectiv and I heard the stories about the nebulizing fluid, and I spoke to Henny, and he told me that when you use it, you say 3 times a day, you nebulize, you can increase your lung function by 2% per month.
Yes.
And this lady, I feel so sorry for her. She's in her late 70s, and her lung function she was on permanent oxygen, one of these machines that the medical aids give them. And I supplied some Trifectiv for her. I decided I'm going to help her, and I got a proper nebulizer with a mist that's fine. And she is much better. She's off her permanent oxygen after about 6 months. Her SATs are 94 now, so she can live a normal life, where she was basically sitting in that chair in the old age home and just sucking on the
absolutely. That's the usual scenario.
It changed her life. Isn't this wonderful?
I think this technology has the ability to change medicine completely, even though people do not know about it yet. It is really phenomenal, the difference between the effect of it, and if I say that the effect with no side effect, because you've got to mention those two. Everything has a side effect. Everything in medicine has a side effect. Even iodine, discovered in the 1950s, is so toxic.
They still use it.
But they still use it. Oh. Here is something that is completely non-toxic, that is far more effective, and prevents scarring afterwards. It's like too good to be true, but that is the case. That is what happens when you use it.
Henny, what is the standard of care now? I know in my hospital what we do, but what is basically the standard of care?
Standard of care refers to what is commonly done by the medical profession and accepted amongst them as the best treatment for specific situations. So standard of care for pneumonia is this and this type of antibiotic together with physiotherapy. And standard of care of wound care usually involves the treatment with betadine or povidone iodine or chlorhexidine, and it's in the form of what they call wet dressings. And standard of care is also these days the vacuum devices put into wounds that suck off the liquid forming from wounds, which is another complete story for us to talk about.
Yep.
Because I believe that's that is not necessarily the best way of dealing with wounds.
That's interesting.
But rather treat the inflammation which causes the wound liquid to form, which is then sucked off. But if you do suck off liquid of wounds, then you can add Trifectiv into the healing environment. That has great potential. So, yeah, that's for the next time. But there's so many things that we can talk about that Trifectiv can do. And again, I want to summarize in the hospital environment, acute hospitals, and in the day hospital environment. especially in the day hospital environment, infection is much less prevalent than in a septic environment or
in acute hospital,
an acute hospital. But it can happen, not because of what the hospital did or the doctors did. Usually it's because of what the bacteria did. They became clever and they became adapted to our usual standard of care, which needs to change. And if we give this new technology a good opportunity to show what it can do,
yes,
there's no turning back.
Yeah, it's very exciting. I think so. I mean, when I was introduced to this product, I got so excited. I said I wanted it yesterday, and I wanted it in my hospital because, as far as possible, I'm going to keep my hospital as safe as possible, and a safe environment for the patients. And but you talked about a study that said that after surgery, a patient can get up to 30 days.
Yes. For the first 30 days after an operation, infection can start at any time. So it is, but then again, I'm talking about they probably refer to biofilm infection because we know more about the types of infection. Acute infection with a redness and pus forming, that is within the first 2 or 3 days.
That's right.
But it's the slow, low-grade inflammation and the slow, low-grade infection with bacteria covering themselves with slime. That's the long-term, very dangerous, lots of scarring, inhibiting wound healing type of infection. The one reacts so violently when you put hypochlorous acid, when you put Trifectiv in a wound, which turns it black, and then it's washed out and it's gone. Thank you.
Yeah.
Thank you for the time. Thank you for being here.
Oh, it was. Thank you for telling me more about Trifectiv. I'm a firm believer in it, and I'm so glad that I was introduced to it about a year ago, and it's going to change the world. I think
Thank
that's
you.
many applications. Thank you.
Thank you.